So in Canada, cyclophosphamide is typically used from first line all the way through multiple lines of relapse. It combines well with IMiDs, and it combines well with proteasome inhibitors. In the multiply relapse setting, typically we'd combine cyclophosphamide with pomalidomide and Dex. This study examined the addition of cyclophosphamide to patients who had been started on pomalidomide and Dex and either were progressing or hadn't achieved at least partial remission by cycle 3. So this is an interesting concept and proof of concept, really, that that cyclophosphamide adds to pomalidomide and Dex, and that's the primary endpoint of the trial: is there benefit in adding cyclophosphamide to pomalidomide and Dex. This was a trial of about 50 patients, including about 36 that either progressed or didn't achieve PR by 3 cycles of pomalidomide and Dex. Cyclophosphamide was added orally, and then the outcome was monitored. And they were able to either improve response or even salvage response in a portion of those patients. So about 50% responded to the addition of cyclophosphamide, which would suggest that the addition of cyclophosphamide could either be done several cycles into pomalidomide and Dex, or could be started at the starting point of PomDex. In this study, the safety was as expected, so there was hematologic toxicity. In my practice, in particular, neutropenia can be an issue, thrombocytopenia can be an issue. In terms of neutropenia, a lot of these patients do require GCSF to maintain their drug intensity early on, at least. Later on, if the patient's responding well, I may reduce dose or add intermittent GCSF. Thrombocytopenia, typically the patients don't end up transfusion dependent, but that can happen. Previously, our information on PomCycloDex really came from the Baz paper, in which some of the patients did have cyclo added later on, and really didn't find that was helpful. This trial presents an alternate endpoint in that adding cyclo later to PomDex was helpful. I think in terms of Canadian practice, our practice would be to begin with PomCycloDex, or at least to begin with PomDex and add cyclo purposely after 1 or 2 cycles, assuming that it's well tolerated. So I think this confirms that the addition of cyclophosphamide to PomDex is helpful. One interesting question is whether PomCycloDex compares well to PomVelcade-Dex, so that could have impact in Canada. Our usual practice at the moment is PomCycloDex. Again, with the optimism data, one would wonder if PomVelcade-Dex might be the preferred option.